Hello everyone, I come to you today with an update on my experiences, my personal, one person only, subjective. I'm not in a professional in any type of way. I'm not an influencer, I'm just a person with taking duloxetine. I'm a person who has a channel, but I'm in no way, any kind of influencer, as you know. So I think this was about 2 years ago, and it is my most popular video, which I think is sort of indicative of people wanting health talk for better or for worse. I mean, there's a lot of stuff out there that is not good. we know. I hope we know. And so this is just one subjective person's experience with taking duloxetine for fibromyalgia and sort of related issues with kind of mood, slightly sort of mild depression perhaps, or just, and also anxiety. I remember that's always been part of my problems, generalized anxiety too, but mainly for the pain associated with fibromyalgia. So even in my case, things are a little complicated by the fact that before we decided I have fibro, I, a long time ago, had been diagnosed with rheumatoid arthritis because I had some blood indicator, plus lots of pain symptoms, the typical symmetrical pain in my hands and my legs and my knees. It was really bad. It was a flare, I think, a rheumatic flare that I've had mild ones since then, but it's never been to the point, after trying all the ones that one gets put on for rheumatoid, which include sort of injection type things, they never seem to work, and I hated the side effects, so I just went off of it. And since it kind of didn't get worse, we sort of just decided, and it sort of changed a little bit to this point pressure pain and generalized pain, kind of a chronic pain syndrome of the nerves flaring too much, or me being, it's very complicated with chronic pain, it's a syndrome. That's what it moved into, as opposed to real RA, which can get progressively worse, and mine really didn't. It didn't get better that much either. It just kind of, it's always there a little bit, and sometimes I'll have flares, and I'm sorry, but in addition to that, I also have a lot of osteoarthritis, mainly in the back, degenerative discs. So the discs are causing me pain. Pretty severe pain, L2, L3 disc disease pain from probably sitting too much and all that good stuff, all that not good stuff. And so you kind of fall into this, I'm sure people know what I'm talking about. You don't move enough because you're fatigued and you're tired from what you have to do for your work. And so, but not moving is bad, but I have to be very careful how I move, because of just issues with the minute I overdo it in a certain way, I get pain, I get inflammation. So anyway, all that good stuff. And the thing is, I still have all of those things. And right now I'm going through the sort of mental load of preparing for retirement, which on the one hand is really good. On the other hand, just the sort of taking the toll of a almost 30-year career of teaching and leaving that behind is just mentally quite a big deal, I'm noticing. And so to get back to the duloxetine specifically, I am also on gabapentin, and those effects have always been more subtle, but there was some time in these 2 years where I thought I might try and go off of it, and I did notice an increase in feeling unwell, so I went back on gabapentin. I just take a low dose. And what has happened with the duloxetine is I still like it. But what had happened, even from when that first video a while ago, I think I was trying to go up to about 60, which even 60 milligrams is still a pretty low dose, because they start you at 30, that's the lowest. But in the meantime, what happened was the stomach pain and cramps from even 60 milligrams, even with 40, I still had some, was so bad for me that I wanted to not have anything to do with that. So I'm at 30, which is extremely low. And I have a feeling some people might think it's not doing you any good. But at least I get the sense that it still helps, not so much with pain, because I think you have to take a higher dose for it to really help with your pain. But it still seems to be somewhat good for my anxiety and my mood. I still get the sense that it's kind of calmed me down a little bit. Not to the point, and in a way I'm glad, not to the point where I'm sort of, you know, a zombie. Not at all. I'm still very, you know, I have days. And but in general, I'd say I still think it's been good for me to be on duloxetine, even though I know you have to be very careful about going off of it. And there was, in the 2 years time, there's been maybe just once or more than once where I forgot to take it for maybe almost a whole day, not quite. And I did start to feel strange. I didn't connect it with not taking it. I just realized when I saw that I didn't take it, it's like, that's why I felt strange. And the strangeness was jittery, and sort of my head felt a bit strange, not sort of brain spasms, and not anything terrible in terms of withdrawal yet. So it kind of, even that kind of calmed me down in case I ever have to go off of it. And also the fact that I'm taking such a low dose, guys. I'm on 30 milligrams, which I know is the lowest that you can take, and that's the only dose I can take without it hurting, causing cramps. And I got more sensitized to the cramps. Maybe it's because of the way I react to pain anyway. I think there's this idea that you could get used to side effects, but with me, at least with this one, I got more sensitive to it, and it got worse. And so I decided to just stay with 30 because I don't have any side effects with 30 as far as I can tell. I mean, I've had issues with stomach issues, but I don't think it's related to duloxetine. I think it's just related to my overall issues. So that's my little update. And just, you know, want to make it clear that this is just one patient's perspective, and I'm not an expert. And I try and stay away from medical influences completely. I don't take any supplements. I mean, I'm trying to look for people who I like. There's this one doctor's videos. Her name is Dr. Andrea Furlan. She's a Canadian doctor who talks a lot about these issues. And I think her talks are really quite useful and kind of, what's the word? Reasonable. It's like she has a reasonable approach. So yeah, that's all I have to say. It's just a short little update. If things are going well as they can go for someone who has, because of the impending retirement, I have had bouts of ill health, specifically digestive bouts that I don't quite know where they came from. I don't think it's medical. I mean, I think it's sort of something internal, some kind of, I don't know exactly what it was, some kind of inflammatory bowel, but that's just separate. That's just, so the regimen that I'm on right now, GABA, duloxetine, vitamin B, vitamin D, and as needed, a low dose hydrocodone as needed, which I take sparingly. But I'm glad I have that in my toolbox for times when I just need it. And I've started physical therapy, and I don't like it much because I don't like moving, but I'm committed to getting better. And one thing I'm going to try and do when I have more time is go into the pool, go do water aerobics or something like that. People say that I should do that, and I think it would be good for my joints. But that's my little update here. So everything's going fine with the duloxetine. I still think it's for me, it has worked quite well at a very low dose. And I am kind of sad that I can't take a higher dose because I really think I'm missing out on some of its benefits because it has that 2 neuro something and serotonin double thing. It's an SNRI as opposed to SS. That whole thing. But I will let everyone go, and please feel free to ask questions. And yeah, I hope everyone's doing well, and I'll be back with a more typical video for me, more bookish content per usual, hopefully soon. Goodbye.